Friends, a very common question I get asked is, what is the best way to get rid of acne scars? Acne scars is a very common problem. It's a sequelae to acne. When you have cystic acne, that inflammation can eat away at the basement membrane proteins of the skin, like collagen, elastin, and leave the skin with depressions. And so this is a very common problem. A lot of people are bothered by acne scars. But I think a better question to ask is not what's the best way to get rid of acne scars, but what's the best way to improve acne scars? Because we can't always get rid of acne scars 100%. So we look for improvement. I think realistically we can improve acne scars on the order of 50, 60, 70, 80, even 90%, but it's hard to get to the 100% mark. Now, I think we need to really have an understanding of different types of acne scars because the treatment protocol is different for different types of acne scars. So I'd like to divide acne scars into three main types of scarring: ice pick scarring, rolling scars, and boxcar scars. So what are each types of scars? Ice pick scars are very deep, shallow scars. These are scars that are left from acne, and as the name denotes, ice pick, like somebody took a sharp ice pick, went deep, and created a deep hole or a scar in your face. Rolling scars are these types of deep depressions. They're deep, they're rolling, and they kind of involve a large portion of the face or the temples or whatnot. And boxcar scars are your typical kind of scars where there are tiny depressions that are not that deep. So I think it's for us just good to have that understanding because we treat different types of acne scars differently. So my go-to procedure for ice pick scars is I like to do something called a punch excision. So where I take an instrument, as you can see, this is like a cookie cutter instrument. I actually punch out each acne scar, ice pick acne scar, with this instrument, and I use a very, very fine plastic surgery stitch to close those ice pick scars. So we're basically transforming these ice pick scars into a very tiny surgical scar through this procedure. Now, some people for ice pick scars do what's called a punch graft, where you actually take a piece of skin somewhere else through a punch and you place it there into the ice pick scar. I don't like that procedure. Oftentimes, the skin does not look level with punch grafts, so I advise you to stay away from that procedure. Another procedure people use for ice pick scars is TCA cross, where they take a toothpick, they put a very high concentration of TCA acid, and they burn a hole, hoping that that hole heals better within the ice pick scar. I don't like that procedure either because you cannot really assess or predetermine the level that acid seeps through that scar. So I've seen really sometimes bad scarring who've been referred to me from that procedure. So I advise you not to do TCA cross technique or punch grafts, but rather find somebody who's good at the punch excision technique. Now, that's for ice pick scars. We talked about rolling scars, and for rolling scars, I'd like to use a procedure called subcision. Subcision is a procedure where I numb the area with some numbing fluid, and I insert a very special type of needle. This is a cutting needle. It's called a no-core needle. As you can see, this needle has a sharp scalpel-like edge to it. So I insert this in and I free up the tethering of the skin to the that's causing the puckering or the rolling scars from the underlying tissue. Subcision is a highly effective procedure for treatment of rolling scars. And lastly, I'd like to combine all these because most people who have these also have boxcar scars. I like to combine these two procedures with a laser resurfacing procedure. So what types of laser resurfacing we can choose? We have the choice of ablative laser resurfacing, the kind akin to CO2 laser resurfacing or fractional CO2 laser resurfacing, or a non-ablative laser resurfacing procedure, like the Fraxel laser. So I like to combine these procedures with the laser resurfacing procedure for our highest yield results. You may also have heard of other things like microneedling, radiofrequency microneedling. Those are some other procedures that we can employ. I don't like that as first line of therapy, but with microneedling, we're using these tiny needles with a machine that go in and out of your skin. They puncture the skin to stimulate skin production. Or radiofrequency microneedling, basically the needles enter your skin, they're attached to a radiofrequency device, and they generate heat within your skin. Examples of a radiofrequency microneedling devices are Morpheus 8 or The Secret. There are many manufacturers of radiofrequency microneedling. So just to recap, you need to know the type of scarring that you have. If you have a combination of scars, you have to know your doctor needs to really employ a number of modalities of techniques to combine them to treat the different types of scarring. And together, if you have this holistic approach and then combine different procedures, you're going to get the best results to improve your acne scars. I hope you find this presentation helpful. Signing off, Dr. Cameron Roxar.